So welcome to our meeting here for the orientation and introduction of this pregnancy yoga TTC. So this course is basically we are giving in focus of the pregnancy, a healthy pregnancy. And we have been doing these courses for quite a few years. I'm myself into this since 25 years. My name is Dr. Preeti Sharma, and I have my team with me today. So I have Dr. Khushbu Biani. She is a homeopath doctor. She has been always there with us with Prana Yoga Center team, anatomy, and this theory part she is teaching. Then I have Dr. Gargi, who has also joined us, and she is the faculty this time in the course. So she'll be also communicating with the therapy theoretical part. And we have Dr. Geeta Bhambani. So Miss Geeta Bhambani, she is very much my assistant, my left hand, as Khushbu and Dr. Gargi. So four of us, we are there in the team. And Geeta ji is teaching the practical part many times. Last two courses, she has been handling the practical part. So I'm very happy to present my team in front of you. And we all give you a warm welcome. So let me just get back to the point. Here we have been, what do you think yoga is essential in pregnancy? Okay, I would call it actually essential. Looking at these last 2 years, the pandemic time, how people have suffered with, and even pregnant ladies who have been suffering from COVID or the effect of COVID, even if the surroundings, even the pregnant lady herself not got affected with COVID, but then surroundings are aware about COVID. So she had suffered, and what effects were there, but how yoga has helped, that also we have seen. Okay, so that is why the yoga part is essential not only for the physical well-being. Don't think of only giving a normal labor to the lady, but yes, her own health during those 9 months. And also the mental attitude, the acceptance, so her emotional upliftment, elevation, all those things are very important when she is pregnant, as you all know, and yoga can help in all these aspects. So we have a beautifully designed program for the pregnant lady, and this whole program has come out with the experience, with our own study. So it is not from anywhere in the books. You must have seen that if you look into the tradition, the age-old traditional books of yoga, like your Hatha Yoga Pradipika, like your Gheranda Samhita, okay, like the Hatha Ratnavali everywhere, you don't find anything about the pregnant lady, about the practices for a pregnant lady. But yes, in a very consolidated way or in a hidden way, they have mentioned some practices where in what conditions you can do, like some delicate conditions, और किसको क्या practice नहीं करना चाहिए, like दुर्बल हो या वृद्ध हो, ऐसा कुछ उन्होंने लिखा होगा कि इसको नहीं करना चाहिए. So we have to understand कि यहाँ पर ये pregnant lady को भी apply करता है. So ऐसा ये छोटी छोटी बातें हैं, but फिर भी योग लिखने वाले उन ग्रंथकारों ने, those people who wrote the text, they have left it to the intellect of the yoga sadhak, the teacher, the therapist. Okay, what is to be given to a pregnant lady and what is not to be given, because yoga is supposed to give its effect to the whole humanity, the whole mankind. So pregnant lady is not, out of it. And when I started with this practice of teaching the pregnant ladies last, 27 years back, so it was a different case. And that time the scene was different. So because yoga, being our own science, was not so much valued also, those days were different, where even doctors were unaware of the effects of yoga. So to convince them was a task. But today's scenario is different, and you have the support of the doctors as well. So in this course of ours, we have people coming in, from all sectors. We have doctors also, we have yoga teachers and yoga therapists also. And we have planned the program completely according to the trimesters. So we'll just show you the glimpse of the syllabus that what we are focusing on. So requesting Khushbu to before. Okay, so Khushbu will display the syllabus and she will just give you a brief idea of the syllabus, what we are going to cover. And before we give you the syllabus, we have Deepa with us, who was a participant in our one of the batches in the last few TTC courses about pregnancy. So I welcome Deepa. Hi, Deepa.
Good evening, ma'am. How are you?
Hi, good. Thank you. Nice to have you here. So
Yes,
nice
it's
of
been
you
a
to come.
wonderful evening and good evening, everyone. I'm just so happy to meet you all. And Preeti, ma'am,
So
it's been
Deepa, yeah, Deepa, please share your experience if you can. How your course has helped you and how you have gone into uh, this subject.
yes, actually, it's been a wonderful journey. The pregnancy, the prenatal yoga therapy. I'm doing my therapy as well with Prana Yoga Therapy Center right now. And I started with this pregnancy workshop, the Health Educator workshop with Preeti ma'am. And the 3 months of the continuous workshop was a complete learning experience. Like we will learn the anatomical part, anatomically, physiologically, what is happening in pregnant women's body, basically trimester wise, which help me to deeply understand why what kind of hormonal changes is going on inside a pregnant woman and how to deal with each and every person is different. Basically that made a lot of sense what is happening inside the body. So this was explained with presentations, and we had speakers from different backgrounds. And we had real-time mothers coming in and giving the practical experiences, how they connected with the baby throughout the pregnancy, prenatal yoga sessions. And Preeti ma'am will give the complete fine experience of how a pregnant woman will be able to connect with the baby. So it was a kind of a complete package, I would say. So it helped me to deeper my understanding, and even now I am able to go through the recordings of ma'am. If I have any doubts, it would really help me to go back. If I have any sort of silly questions also, if I get in touch with ma'am, she will be able to answer me. And during the sessions, and it was a complete compassionate teacher she is. So we don't have any hesitations or any things in between. We can just go ahead and ask anything with her. So the complete Kushbu ji, and I have to thank Kushbu ji as well. Her presentations, the PPTs are really helpful. Even now, if I go there and I'm able to go and fine tune my knowledge about this, what is happening in each trimester wise in women's body and all those things. Basically, I'm doing my therapy now, so this PPTs in turn help me to get in touch with the therapeutic part of the yoga TDC as well. So thank you, Kushbu ji, for that, and Geeta ji as well. Thank you so much. Preeti ma'am, it was a wonderful experience. And when I get in touch with each pregnant woman, the compassionate, the counseling which I have to give them first understanding their experience is very important. That you have taught me. So that helped me to first understand where the pregnant women is and how to deal with them first of all, because each and every person is different, their background is different. And just like that, we cannot teach them like as any kind of person. Normal person is different, a pregnant woman's mindset is completely different. There are so many hormonal fluctuations going on within them. So understanding them, the counseling part you have taught us very well. So thank you for that as well. And you will
Thank you,
have a
Deepa.
great learning, all the participants here, and you will have a whole lot of experience and lot of learning. Yes, I'm sure about it.
Thank you, Deepa. So you have started teaching in a group of pregnant lady, like group class or like individual classes?
Yeah, individual classes, ma'am. And even I am just connected with the gynec here nearby.
Okay,
Different trimester wise I am handling, and but personal classes, I am taking personal classes, not
very
group
good.
one.
So how was your experience? How is your experience, I would say, to work with the gynec?
Yeah, we are able to the clinical laboratory, the reports we are able to read it first of all after this workshop. Basically, the placenta previa and the terms, the terminologies, which was new to us. Now it has been more clear. Now we are able to read the reports and get in touch with the gynecs and what is going on with the pregnant women. All those things definitely it helps me, ma'am. That
So
I'm sure
good,
about.
you are able to communicate with the doctors in a
Yes.
better way.
Yes. Medical
So good.
terminology, we are aware of it now. After the workshop, we are completely aware of what are the different complications will be there in labor and everything. We are very clear now. So we are able to get in touch with gynecs. Yes, ma'am.
Mhm. So yeah, that helps a lot actually. No?
Yes,
When you are more educated, you are educated, you know your knowledge enhances and
yes,
you can work better.
definitely, ma'am. And the person who is more passionate to learn more about this anatomical, physiological part, when it dealt with the gynecs, it keeps us more and more understanding is happening there. So
Mhm.
this workshop definitely has opened up the lot of factors. Yes, definitely, I would say.
Thank you. Thank you.
Thank you, ma'am.
So Deepa is having her therapy exam soon. So
Yes.
still she got time. She found time to spare and be with us. Thank you, Deepa, for joining and giving your valuable feedback.
Thank you, ma'am. Thank you so much. Yeah.
Okay. So we move ahead with the syllabus. Khushbu, can you go ahead and explain the syllabus
Yes,
briefly?
ma'am. Yes, yes.
Thank you.
Thank you so much, everyone. So, first of all, welcome all of you to the orientation program. I'll just share the syllabus and we'll discuss it briefly. So, this is our syllabus of Yoga Health Educator Certificate course in pregnancy. This course is specifically only for certified yoga teachers because this is a skill enhancing course, as already mentioned. The duration of this course is around 50 hours and will hold an exam after the course completion. We hold an exam which is very similar, in fact, very similar to our YCB exam pattern. We keep a theory exam and we keep a practical exam. Theory exam will be MCQs as in multiple choice questions. It will be a 50 mark, one question of 1 mark, and practical also of 50 marks, where the examiners will be conducting your exam and then they will give you marks accordingly. It is compulsory to pass individually in both theory and practical to get the certificate. Okay. Then going ahead with the syllabus. So we have two units. As you can see, unit 1 is anatomy and physiology, and unit 2 is related to yoga and lifestyle. So both the units go hand in hand in this course. The anatomy and physiology part and the yoga and practice part goes hand in hand, as in which the portion is completed. As in, first of all, the portion will start with discussing general anatomy, some part of general anatomy, as in what is anatomy, what is important to study in it, and then we will briefly discuss about the reproductive system and the endocrine system of the body. Okay, these two systems which are very much important to study if we go ahead with pregnancy. Then after reproductive and endocrine system, we even discuss menstrual cycle in detail about everything. 28-day cycle, what is there in the cycle, what during what period, what happens in that cycle, everything in detail. And once we have discussed about everything normal in a female body, उसके बाद हम लोग डिसऑर्डर्स की बात करेंगे. डिसऑर्डर्स मतलब क्या, मेंसेस के रिलेटेड हमने देखिए इर्द गिर्द एवरी फीमेल मस्ट हैव वर्ड कितने सारे डिसऑर्डर्स होते हैं, कभी जल्दी आता है, कभी लेट आता है, सो कभी ज्यादा फ्लो होता है, तो व्हाट आर दोस और व्हाई आर दिस हैपनिंग, तो दैट ऑल इज डिस्कस्ड इन डिसऑर्डर्स ऑफ मेंस्ट्रुएशन. एक बार जब हमने डिसऑर्डर्स ऑफ मेंस्ट्रुएशन कर लिया, उसके बाद हमारा सेशन होता है प्रैक्टिकल वाले पार्ट पे, विच इज योगा एंड लाइफस्टाइल, योगिक प्रैक्टिसेस फॉर मेंस्ट्रुअल डिसऑर्डर, और ये होता है प्रैक्टिकल सेशन जहाँ पे आपको प्रॉपरली प्रैक्टिकल सिखाया जाएगा और आपसे करवाया जाएगा, एंड one person will be observing you, one person will be teaching you. So properly it will be taught to you कि menstrual disorders में अगर मेंसेस की किसी को तकलीफ है तो उनको आप क्या क्या प्रैक्टिसेस करा सकते हैं. अच्छा, देन अगेन गोइंग बैक टू द यूनिट 1, एक बार हमने मेंस्ट्रुएशन की बात कर ली. प्रेगनेंसी में घुसने से पहले, नाउ दिस इज अ चेरी ऑन द केक फॉर यू फॉर दिस कोर्स, दैट यू विल बी आल्सो टॉट portion of PCOS, pathophysiology of PCOS. What is pathophysiology? As in PCOS किसको होता है, क्यों होता है, इसके पीछे के क्या क्या कारण होते हैं. So all this you will study in anatomy and physiology along before you study pregnancy, because we very well know अभी PCOS कितना ज्यादा होता है लड़कियों को. Nearly 3 out of 10 women around are suffering from PCOS. एक बार जब PCOS का एनाटॉमी फिजियोलॉजी हम पढ़ लेंगे, एज इन पैथोफिजियोलॉजी इज द राइट वर्ड, देन सेम रिलेटेड वी विल डिस्कस योगा प्रैक्टिसेस ऑफ PCOS. तो जो भी योगा, व्हाई हैव आई रिटन योगा प्रैक्टिसेस, बिकॉज माइंड यू हम लोग सिर्फ आसन नहीं सिखाएंगे, एवरीथिंग व्हाटएवर दिस योगा प्रैक्टिस कैन इंक्लूड, प्राणायाम हुआ, क्लेंजिंग प्रैक्टिस हुआ या आसन हुआ, जब जो जरूरत है यू विल बी टॉट अकॉर्डिंगली, राइट. दैट इज व्हाई एवरीवेयर आई हैव रिटन योगिक प्रैक्टिसेस and not specifically asana or pranayam. Pathophysiology of PCOS discuss हो गया. अब now from unit 1 we will enter the pregnancy. तो pregnancy we all know 3 trimester में होती है, first, second and third. तो एक एक trimester in detail discuss होगा. एक एक trimester में जो normal है trimester, normal trimester क्या होता है वो discuss होगा, और एक एक ट्राइमेस्टर में क्या क्या डिसऑर्डर्स या क्या क्या बीमारी हो सकती है उस ट्राइमेस्टर में, वो मदर को हो या बेबी को हो, वो दोनों इन डिटेल डिस्कस हो. और जैसे जैसे एक एक ट्राइमेस्टर खत्म होगा, एनाटॉमी वाला पार्ट, जैसे थियोरी खत्म हो गया फर्स्ट ट्राइमेस्टर, उसका डिसऑर्डर भी हमने पढ़ लिया, उसके बाद हम लोग योगा प्रैक्टिस करेंगे, प्रैक्टिकल क्लास होगी फर्स्ट ट्राइमेस्टर की, फिर सेकेंड ट्राइमेस्टर डिस्कस होगा, फिर उसकी प्रैक्टिकल क्लासेस होगी. ये सब चीज की प्रैक्टिकल क्लासेस होगी. और ये ट्राइमेस्टर्स में हम क्या क्या पढ़ेंगे मैंने ऑलरेडी नीचे लिख दिया. एंडोक्रिनोलॉजी, मतलब तीनों ट्राइमेस्टर्स में हार्मोन्स का क्या फंक्शन है, कौन से हार्मोन्स कितने रिलीज होते हैं, क्यों होते हैं, और व्हाई इज इट इम्पोर्टेंट फॉर अस टू नो ऑल दिस. देन डिसऑर्डर्स इन प्रेगनेंसी, मैंने पहले ही कह दिया कि पहले ट्राइमेस्टर में एक लेडी क्या क्या प्रॉब्लम्स फेस कर सकती है, सेकंड में क्या कर सकती है, ये सब ट्राइमेस्टर के साथ साथ चलेगा. फिर हम लोग ये भी पढ़ेंगे एम्ब्रायोलॉजी. एम्ब्रायोलॉजी मतलब क्या, प्रेगनेंसी में हम जो मदर है उसकी बात करते हैं कि वो मदर में क्या क्या चेंजेस होते हैं. एम्ब्रायोलॉजी में अब जो बच्चा अंदर है, जो बच्चा बड़ा हो रहा है, उसकी बात करें कि उसमें कैसे कैसे चेंजेस आते हैं, वो बच्चा कौन से महीने में सुनने लगता है, कौन से महीने में उसके बाल आते हैं, स्किन आता है. व्हाई विल वी डिस्कस ऑल दिस, क्योंकि इससे रिलेटेड we will have some yogic practices or some guidelines in Ayurveda also, right? And then ये सब जब करेंगे उसके साथ ही साथ our practices will go ahead, as you can see point number 3 in unit 2, yogic practices for first trimester, second trimester, third trimester. इसके बाद ये जो हमारे 3 important sessions हैं 6, 7 and 8, nutrition and diet during pregnancy, गर्भ संस्कार and Ayurveda in relation to pregnancy. So these are going to be very very interesting sessions. Theory sessions होंगे but बहुत interesting sessions होते हैं. Nutrition में आपको ये जानने मिलेगा कि हर trimester में क्या क्या nutrition आप दे सकते हो in detail. Then you will come to know गर्भ संस्कार. अभी जैसे मैंने कहा जो embryology हम पढ़ेंगे as in the growth of the baby, कौन से महीने में वो सुनना शुरू करता है बाहर की आवाजें और वो सब, ये सब हम जब ये नॉलेज लगा के we will study गर्भ संस्कार. गर्भ संस्कार as in जो बाहर का एनवायरनमेंट है उसके ऊपर उसको यूज करके हम बच्चे के लिए क्या बेनिफिट कर सकते हैं. सो वी विल स्टडी अबाउट गर्भ संस्कार आल्सो एंड आयुर्वेदा इन रिलेशन टू प्रेगनेंसी. डेफिनेटली वी विल स्टडी दिस आल्सो बिकॉज योगा एंड आयुर्वेदा गो हैंड इन हैंड. तो हम योगा पढ़ रहे हैं तो आयुर्वेदा को हम नहीं छोड़ सकते, तो योगा आयुर्वेदा वी विल डू. एंड देन थेरेपी योगा फॉर प्रेगनेंसी डिसऑर्डर्स. अब जैसे जनरली आप सुनते हैं पहले ट्राइमेस्टर में कुछ औरतों को बहुत उल्टियां होती है, तो अब ये उल्टियां बचाने के लिए हम क्या प्रैक्टिसेस कर सकते हैं. तो ये एक एग्जाम्पल था थेरेपी योगा फॉर प्रेगनेंसी डिसऑर्डर्स। तो हर ट्राइमेस्टर में जो जो डिसऑर्डर हो रहा है उसके अकॉर्डिंग हम प्रैक्टिसेस भी लर्न करेंगे। और ये सिर्फ लर्न नहीं करेंगे, हम साथ साथ करेंगे भी प्रॉपरली। इतना ही नहीं, प्रॉपरली सेकेंड और थर्ड मंथ में जितना माँ का पेट होता है ना, वो कुशन लगा के हम फील करके प्रैक्टिस करेंगे प्रॉपरली। और ये हम हर टाइम कराते हैं, इंटरेस्टिंग भी होता है और आपको समझ भी आ जाता है कि करना कैसे। उसके बाद आप एक बार प्रेगनेंसी के 9 महीने हो गए, तीनों ट्राइमेस्टर हो गए, हम नॉर्मल लेबर थोड़ा सा सीखेंगे। नॉर्मल लेबर एज एन जब डिलीवरी होती है, जब नॉर्मल डिलीवरी होती है, हम वो समझेंगे। जनरली जरूरत नहीं पड़ती है कि एक योगा टीचर आपको एज अ सपोर्टर, यू हैव टू गो इनसाइड विद योर क्लाइंट in the delivery room. But maybe if the client has a lot of trust on you, she might call you कि अगर आप आ सकते हो डिलीवरी में, तो you should know at that moment हो क्या रहा है अंदर और आप क्या क्या उसकी हेल्प कर सकते हो। या ये उसमें भी मदद आता है कि आप पहले से अपने क्लाइंट को गाइड कर सकते हो कि दिस इज हाउ नॉर्मल लेबर हैपेंस, और इन द डिलीवरी रूम वो क्या रह सकते, हाउ कैन शी स्टे काम देयर, मतलब even after that pain what is she supposed to do. So this you will learn. Now once the delivery is done, अब after the pregnancy, जिसको हम कहते हैं post natal, after pregnancy जो period होता है उसको कहते हैं post natal. तो हम post natal के बारे में जो normal changes होते हैं post natal, that we will study. post natal में कुछ complications हो सकते हैं, that we will study. Okay, and related to that, again coming back to the your yoga and lifestyle unit 2, postnatal practice और postnatal counseling पढ़ करेंगे। postnatal counseling आप सब इस चीज से गो थ्रू किए होंगे कि जब पहला बच्चा होता है तो पता नहीं होता है कई बार अब क्या करें, और आफ्टर सम टाइम द फीमेल्स आर लॉस्ट। तो ये postnatal counseling आप सीखेंगे कि यू आर जस्ट नॉट yoga teacher for them, you will be yoga therapist, yoga counselor for that lady. And then contraindic, और फिर हम साथ ही साथ लास्ट में सोनोग्राफी रिपोर्ट्स पढ़ना भी सीखेंगे। जो भी सोनोग्राफी रिपोर्ट्स प्रेगनेंसी के दौरान कराई जाती है, तो वो रिपोर्ट्स में क्या क्या लिखा जाता है, किसका क्या मतलब होता है, ऑल दैट वी विल डिस्कस प्रॉपर्ली इन द थ्योरी पार्ट। एंड अगेन कमिंग टू योगा एंड लाइफस्टाइल, लास्ट पॉइंट कॉन्ट्रा इंडिकेशंस, मतलब लिमिटेशंस, क्या नहीं करना है प्रेगनेंसी में, ये हम सीखेंगे। ये हमारे लिए भी सीखेंगे कि हमें क्या नहीं करवाना है, और हमें हमारी क्लाइंट को क्या बोलना है, या फिर हमें हमारी प्रेग्नेंट लेडी को क्या बोलना है कि आपको भी नहीं करना है। तो कॉन्ट्रा इंडिकेशंस आल्सो वी विल लर्न। नाउ व्हाट ऑल विल यू गेट फ्रॉम दिस कोर्स? लास्टली, confidence to conduct customized prenatal program for every trimester. Our students have actually gone ahead and had a discussion with this gynecologist around them. जब आप एक बार ये कोर्स करते हो उसके बाद यू गेट दी कॉन्फिडेंस कि आप गायनेकोलॉजिस्ट के सामने बैठ के बोल सकते हो कि हम प्रेगनेंसी योगा करा सकते हैं। और जब आप इतना एनाटॉमी एंड फिजियोलॉजी पढ़ते हो और आप जब सही टर्म यूज करते हो, सो व्हेन द गायनेकोलॉजिस्ट कैन ट्रस्ट यू कि नहीं, शी हैज और ही हैज द नॉलेज, the person has the knowledge and I can trust this person to let my pregnant ladies go and learn yoga from them. So this confidence you will definitely get. Then you get PDF notes, हर एक चीज का आपको proper PDF note मिल जाएगा जो भी हम सिखाएंगे उसका, and YouTube recording of all the sessions. And ये YouTube recording, this will be there with you, जब तक YouTube रहेगा तब तक आपके पास रहेगी ये recording. So बाद में भी कभी आपको refer करना है कि क्या सिखाया था, you can always refer. As Deepa ji said, कि she still refers to those recordings, so you can always refer it back. It's not just जब तक course है तब तक है, बाद में भी आपके पास ये हमेशा रहेगा. So this is about the syllabus of pregnancy yoga. Yes, ma'am. So if you have any doubts related to the syllabus, you can definitely ask.
Thank you, Khushbu. And I'll also request Geeta ji to just say a few words, 2 minutes, so that everyone knows her.
Hello, everyone. Thank you, ma'am. This course, I will say that we have been doing workshops since I passed my therapy and I became a yoga teacher. And it has been a great learning for me too. In each batch, I also learn a lot. And when, as Dr. Khushbu said, we go hand in hand, that we take the theory part and we take the practical part. So I am responsible for the practical part. So it becomes very easy for the students also to understand. Once we do the mensuration part and then we do the practical of that, so they can relate very well. And like you have seen that we take full lifespan of a woman from the day one she starts menses till menopause. So we cover entire, life of a woman, that what stages she goes on. And that is a very beautiful journey. You will enjoy yourself, because we all are women here, and we go through all these things. And men also have joined. It's not that way that it is women oriented program. So many men have also joined, and they were very benefited, because they taught their wives, or they were able to guide their clients very well. So that was a very beautiful and nice experience for us also, that we had to teach men also. And during the practical session, as Dr. Khushbu said, that we put the pillows and all. So it's like fun. It will not be a boring session for you when we teach anatomy or when we teach practical. We see that we are in touch with all our participants, and we also tell them to participate. When once your cameras are on, you also are talking with us, it gives a motive to us all to speak. And more questions we really like, because more and more you will be asking, it will be clearing the doubts then and there. And as you heard from Deepa. So Deepa ji said that ma'am is very patient. You ask her 100 times also the same questions also, she doesn't get bored or she doesn't get irritated. So she will be answering. Her pranayam sessions are very beautiful. You'll be enjoying yourself. And first time when I did this, I thought that I didn't get this opportunity when I was pregnant. But anyways, I'm enjoying. And after that, I also am taking personal classes for many women, like PCOD patients and infertility and pregnant ladies. And really, it is a great help for the society also. Coming to the part when we speak, when we become like a friend to them, that is a very important. Nowadays women can't speak. किससे बात करें, कहाँ बोलें, किसको बताएं, कोई समझने वाला नहीं है. All these questions come in their mind. And when you be a guide, a mentor, a friend, they really rely on you, and you also gain confidence and you feel better, you feel nice after doing something for the society. And after all, when we are helping and giving some samaskaras by doing the prayers and meditations, this will inculcate in the child, and he or she will be a nice citizen of India or anywhere in the world. And this is a great thing that we will be doing for the society. Thank you. With these few words, I'll hand over to Dr. Khushbu.
Hello. Yeah, thank you, Geeta ji.
Thank you.
Thank you. And Dr. Gargi, can you come forward and give your introduction and how yoga has helped you?
Yes. Hello, good evening, everybody. I am Dr. Gargi, and I am a dental surgeon by profession. I am been practicing since now 30 years, dentistry, but I'm very new to yoga. I have been in this field since the past around 4-5 years. And I was introduced to it by Dr. Ghansham Sharma and Dr. Preeti Sharma. So I started at level 1, went on to level 2, 3, and finally up till the therapy consultant level. During the journey, I also attended this workshop on PCOS, pregnancy, and whatever they have discussed, everything is absolutely true because I experienced it for myself. And in my practice also, when we take a history for dentistry also, we see that the increasing number of patients are having this PCOS and PCOD problems. A lot of the young girls are going through this. And when I know the reasons after having studied in this course, I mean, as when they come to me for their dental problem, but we have to discuss with them, okay, so are you on any medication? Is there any other problem? If you have to extract or do any inject them, we have to ask the history. So then eventually when we come to know that they are having PCOD or PCOS, we are able to explain to them, okay, when we take the history, we're able to explain to them a lot of things which they are not sometimes aware of, which can be rectified by their regular yoga practice. So as a yoga practitioner myself, and I'm able to help these people. And I have seen a lot of queries coming from pregnant people about pregnant women, how to get back in shape also after pregnancy. So uh, I feel this is a great opportunity for the yoga teachers to increase their knowledge. Everything is done in a very nice, detailed, and in a friendly atmosphere, and a lot of clearing of doubts, and you get a lot of knowledge and also the confidence to execute that knowledge, because each one has to deal with people. People are different. Pregnant, everybody will get pregnant, but the challenges which each person faces, and you as yoga teachers will experience different kind of challenges. Some people will have physical difficulties, some will have physiological, some will have psychological. So you will get kind of an all around acumen how to treat these, how to approach these different people who come to you. So if you all have decided to do it, I think it's wonderful. You should do it. And what else can I say? You have to practice makes perfect. And madam has been in this field since so many years, and she has really mastered this technique of how to go about it. Program is a nice airtight compartment. All the features are very well executed and very well thought about. So that's the beauty of the entire program. And I would strongly recommend it. Thank you.
Thank you, Dr. Gargi.
Thank you.
And we have one more nutritionist on the panel. She could not join, and one Ayurveda doctor as well. So in the course, you will meet all of them. So it's basically a teamwork, you know. I admit that I cannot do everything alone. So I have a beautiful team, and I'm very happy to have such beautiful souls in my team. So friends, this is the whole this thing, an outline about the course, and I'm very happy that this has helped a lot of yoga teachers, and plus we have helped a lot of pregnant women. So we have had beautiful stories of how we could handle cases wherein, you know, we could also move the position of the baby. As you all know that the baby's head should be down, right? When the baby lady is in the 9th month. So baby's head should be down and the legs should be up. So we had a case where the head was up and the feet were down. And with yoga practices, we could actually turn the baby in 180 degrees, and that too in the 8th month. So it was a very good experience, and the lady, she delivered normally, so without any cut. So it was a very good, happy moment for all of us, for the client, for our yoga teachers, and for me as well. So beautiful experience. We will, during the course, we'll share with you the sonography reports, how the baby has turned. And then the lady, she herself being a gynecologist, she actually, you know, she was amazed. Even the sonologist was amazed. So yoga has given very beautiful experiences. We had cases where the women, there was a woman who had a threat to deliver before time. I mean, much before time, wherein the doctor was also thinking that then I would have to put the baby in the NICU. So 8th month, if the lady delivers, then, you know, they have to take special care and all that. So doctor was also scared that she might deliver in the 8th month. But with yoga practices, how we applied, and we could retain her pregnancy in a healthy way for complete 9 months. And she had a full term normal delivery. So complete 9 months she had, and with our yoga practices, she could retain. And the baby, I know the baby is still, you know, they are in my vicinity. So the mother and child, I know the child is now 8 years. So 8 years back, this case had happened, and very intelligent child and very nicely happy child. So yoga has given very good experiences, and I'm very happy to share with you all of these experiences. So it's a complete experiential knowledge which would be shared with all of you. And nothing to hide, everything, whatever we know, we'll just open out the box. And we are planning to start this course. So it will need 25 sessions, 2 hours each session, around 50 hours, and exam, theory, practical, as we have explained to you. So feel free to connect with us. Our numbers are there in the flyer which you have got, the digital poster. So yeah, we are open for questions if any.
Madam, what is the mode of, how do we payment ka mode kaisa rahega?
Online payment, I mean bank transfer or Google Pay, any UPI thing, whatever you're using.
Okay. With the same account, with the number which is being shared?
Yeah, it's the number is 9820346185. Khushbu, can you put it in the chat box, please?
And ma'am, it is going to start from 25th itself, right? You're not going to wait or so, something like that.
No.
आप start ही करेंगे ना? 25
Yes,
तारीख.
yes.
Okay.
So, you are comfortable with these days? Maybe Saturday, Sunday, you are comfortable, or which day?
See, ma'am, practically speaking, कैसा है, weekend में कहीं जाना होता है, कहीं कुछ program वगैरह, not every weekend, but I would, see, it's okay with me. You have the recordings also. Weekday, for me, Monday, Wednesday, Friday, I think that would be preferable. But
Okay.
Saturday, Sunday also no problem.
So we are taking registrations for both sets now only. So,
Okay.
So now whatever जितना majority अभी के लिए मतलब majority जो आएंगे उनको हम लोग वो set of classes अभी शुरू करेंगे, and after a few days the next set of classes. So weekend या weekdays. So we are taking both registrations, and we will start with those classes which are in majority demand now at present, and after 15 days और जितने registrations आएंगे दूसरे set of classes के लिए, we'll start with that course just after a month. So same thing, but the registrations are open for both set of classes. Any more questions?
I'm interested
Okay.
for it. Ma'am, from 25th April, whatever batch you are fitting in, I'm into it.
Yeah, sure. So kindly fill up the form, and confirm your registration.
Yes. Thank you, ma'am. Yes. Looking forward for the session.
Yeah, me too. We also love to meet all of you.
Thanks, ma'am.
So friends, shall we close the meeting now? If there are no more questions. Okay. So we'll close here. We'll wind up. Any more questions? We are available to talk. So you can just note down that number. There are 2 numbers in the flyer, and Khushbu has displayed my number as well. So anytime you can pick up your phone, call me, ask your doubt, no problem. At least we can be friends. So great learning with all of you, for us also, and looking forward to see you. Bye-bye.
Thank you.
And thank you, team, for joining.
Yeah.
Thank you. Bye-bye.
Everyone, thank you, ma'am.
Everyone.
Thank you. Thank you, ma'am.